The Angkor Hospital for Children in Siem Reap has stood as a shining beacon since 1999 for impoverished and malnourished Cambodian children in desperate need of medical care, and has become an essential part of the social fabric of central Cambodia.
I think Angkor Hospital is wonderful, and I think the kids that come here get great care. But the kids that come here are lucky to get here.
The incredible efforts of the dedicated staff make a difference every single day to the lives of ordinary Cambodians in a country where more than 1/3 of the population is forced to survive on less than $1 per day. The triage area in any hospital is usually the centre of activity. At Angkor Hospital for Children, this concept is raised to a different level. Some of these patients have travelled over 100 miles to receive treatment, and many camp overnight to ensure they get it.
At nighttime, this is a big camping area. Yeah, if you come here at night, you'll see mosquito nets up, hammocks up. It's quite a scene here in the evening times. A lot of the patients who you see waiting may not need to see a doctor, but they will be at least seen by a nurse. Of course, the hospital is open 24 hours for critical cases and emergency room cases, but there are some outpatient cases who are asked to return the next day if they're not too ill.
Angkor Hospital for Children doctors see 300 to 400 outpatient children per day, and 50 inpatient beds are maintained in the hospital. With so many seeking treatment, the inpatient wards are continuously full, often with children suffering from ailments that may not be life-threatening in the West.
So this little guy here, he's a 10-month-old, just came probably an hour ago, 2 hours ago at most. And pretty much on death's door, severe dehydration, severe malnutrition. He weighs 10 pounds and is 10 months old. Brought in by his 10-year-old sister and his father. His mother died basically unknown causes.
The impact of poverty in Cambodia cannot be overstated, and children feel the most brutal consequences of that poverty.
Kids come here from so far away that by the time they get to the hospital or get referred to the hospital, they are sicker than anything we're used to in the West. And this is one of the lucky ones, but for every one of him, there are several who come in who don't make it.
It's extremely important for facilities such as Angkor Hospital for Children to continue to be able to provide much-needed services to all who need it. The emergency room is always in full use, as in most hospitals, and the staff is trained to offer the best of care. Treatment is sensitive and professional, and if the most extreme cases can make it through here, then the likelihood of recovery is greatly enhanced.
I think the overall mortality and morbidity rate have gone down, and again, in the ICU, appreciably, definitely. The sickest patients, we are taking better care of them.
Patients in the surgical ward also have a much better chance to survive any illness. And in a country where 1 in 7 children dies before the age of 5, this is a vital element in the basic survival of a developing country. The acute care ward for recovering patients is part of the extensive inpatient facilities that have made Angkor Hospital for Children one of Cambodia's leading hospitals. Many children do not survive, even in here. But at least here they do have a fighting chance to battle back from diseases such as meningitis, pneumonia, and HIV/AIDS.
The ICU is probably the one area where the improvements are most marked. In the last year, we've implemented protocols, standardized guidelines on how to treat various common illnesses such as sepsis or respiratory failure. And we can really see a change in how well the most critical or the sickest patients are being cared for at Angkor Hospital.
Angkor Hospital for Children's operating theatre is staffed with experienced Khmer surgeons and doctors from other countries who volunteer their services. As an officially recognised teaching hospital, Angkor Hospital for Children works in conjunction with the Cambodian Ministry of Health to train government doctors, nurses and health workers in addition to its own staff.
In a full-time capacity, we have 10 junior pediatricians, similar to what we would call residents in the United States, and we have 8, or now 9, including myself, senior pediatricians, which would be similar to an attending role in the United States. And then we have 3 surgeons as well, pediatric surgeons.
Education is a vital component in the success of Angkor Hospital for Children. Visiting doctors provide much-needed alternative perspectives on various aspects of treatment.
Last year, there was one specific course that we ran the course 20 times. It actually got to the point where we actually had to build 3 new classrooms last year just to accommodate all of the requests that are going on.
The Capacity Building and Health Education program seeks to improve the health, hygiene and nutrition of local communities, and hospital staff members make regular visits to the outlying areas.
Capacity building means you actually go into the villages and you teach basic health, basic nutrition and hygiene. And a lot of the health issues that come to us could have been prevented by very simple interventions at that level.
It is obviously important for the kids to learn about the basics of health and hygiene, but it is equally important for parents and community elders to participate in this essential program.
85% of the population lives in the countryside. Unless we target education to those health workers working in the countryside, it's not really going to change the health of the country. I think what Angkor Hospital for Children is doing and what the doctors and nurses are doing here by teaching those workers in the countryside, that's going to make the significant, sustainable impact.
Children with chronic health conditions such as HIV/AIDS, severe malnutrition and epilepsy require regular medical attention. To save children the often arduous journey to the hospital and guarantee the follow-up care they need, Angkor Hospital for Children provides at-home visits through the home care program.
Often people can't come into the healthcare center because it's just too expensive. So what the Angkor Hospital for Children does is they come to them. The nurses come evaluate patients who've recently been discharged from the hospital to make sure that they're taking their medicines, to do a basic healthcare check, and essentially prevent them from having to come back into the hospital. That's highly cost effective.
The development of Angkor Hospital for Children has been remarkable. It is now a real asset in Cambodia's re-emergence into the developing world. Former President Bill Clinton was able to see the progress during his visit to the hospital. In itself, a testament to the hospital's efforts to raise international awareness. The hospital needs your help to ensure they can continue. Angkor Hospital for Children's model for success can be applied to other regions in rural Cambodia. And this can only be achieved with the support of generous donors like you from around the world.